I'm Dr. Sathya, Clinical Director, Cloudnine Fertility Chennai. I'd like to talk to you about the common indications for doing IVF and the process of IVF and the success rates following the same. The common indications for doing IVF or ICSI are: one is a repeated failed intrauterine insemination cycles, or a woman who has blocked fallopian tubes on both sides. Third is when the male factor semen parameters are very poor, this we can do for IVF. And certain other conditions where we want to prevent genetic abnormalities, we can do IVF. So, these are the common indications for us to do IVF. The IVF has got four major steps. The first step is to get the woman to produce plenty of eggs. Normally in one cycle only one egg is produced, but for IVF we would like to have say 10 to 15 eggs. So, to achieve this, we start the woman on certain injections from the second day of her cycle. These are called gonadotrophins. And while she is on these injections, we serially monitor her by ultrasound to make sure the eggs are growing and to also get an idea as to how many follicles are growing. Usually it takes about 10 to 12 days for the follicles to be ready. When we say ready, we mean that the follicle size would have by then reached about 18 to 19 millimeters. Once we have reached that stage, we know we are ready to retrieve the eggs. We move on to the third step, and that's called egg collection. And during egg collection, the process is done under ultrasound guidance under anesthesia. So, it takes generally about 10 to 15 minutes only to do this procedure, and there is no scar on the tummy, no operation. It is just a needle going in from below under ultrasound guidance. We see the follicles as about 2 centimeter sized fluid filled sacs. These are punctured by a needle, and the water content of the follicle is aspirated and the egg comes out with it. Now, once we have collected all the eggs, we get the husband to provide his semen sample, and after a few hours of incubation, the sperms get injected into the eggs, and within 3 days the embryos are formed. However, we usually do not transfer the embryo in the same cycle. As a matter of policy in our unit, we create the embryos, freeze them, and we transfer them in a subsequent cycle. This is because our pregnancy rates following frozen embryo transfers is better than those with fresh embryo transfers. The reason is not that freezing helps in improving pregnancy rates, but the fact is that in the cycle in which a woman is taking injections, her hormone levels are very high, and that reduces the receptivity of the uterus. Whereas in a subsequent cycle, when she is not on any injections, we prepare her with just tablets to prepare the lining of the uterus. The hormone levels are more conducive for implantation. So, as a routine, we go for a elective frozen embryo transfer in the immediate next cycle. Now, this requires preparation with certain hormonal tablets for about 2 to 3 weeks, after which the lining, once it reaches around 9 millimeters, we are ready to replace the embryos 2 at a time. And embryo transfer is also done under sedation to make the process easier for the patient. 16 days after this, she does a pregnancy test to know whether conception has happened or not. In these 16 days, she carries on with her usual work routine, doesn't need to be taking any kind of bed rest. There will be a set of medications which are extremely important that need to be taken correctly. Once the blood test is positive, we do an ultrasound scan a week or 10 days later to make sure the pregnancy is inside the uterus, and 2 to find out whether 1 or more have implanted. Thereafter, the next assessment happens at 12 weeks, by which time we would know whether the pregnancy is continuing or has stopped growing. Most of these pregnancies do continue, whereas some, if the embryos were not of good enough quality, are rejected by the mother's body. By 12 weeks, the pregnancy is well established, and the couple are encouraged to announce to the world about their good news.